What I'm going to comment on is what I would call a question of relevance and the subject areas of relevance, which have to do with trying to understand the contribution and risk of A, N, D, T, and G in any culture, in this case Swedish culture, and what are the ways forward in responding to it, both in terms of looking at treatment and looking at prevention and policy. So first I'll start with just epidemiological research. This is an area that's been particularly strong for Sweden, and it was reflected again in the 5-year window we were operating with, that there has been a consistent production of high-quality published science in international journals. And I'll say once again, that was the input data that we were given, were the papers that were published in refereed journals. As has been again, a strong tradition in Swedish research, especially in epidemiological research, is your use of registries and surveys and cohort data coming from the United States. We covet the Swedish registries, which are, and as do others, right, David? We wish we had such things available to us. It gives you a rich history, and you have been using them very effectively. Including in that is the newer research on genotyping of patients and looking at the interaction and contribution of genetic typing and their contribution to alcohol consequences, and in some cases other substances. Another area of importance and emphasis in epidemiological research in Sweden has been looking at the consequences of use, particularly alcohol consumption, but other drugs, and gender, men and women, looking at social classes and early consequences even in university students. Fetal alcohol syndrome, an area of interest to all our countries, has been another strong focus and an emerging area that's in published science. Treatment research, and we will make comments on treatment research in other ways, but I have limited my comments to those that are uniquely, have been particularly emphasized in Swedish research. One of the unique contributions of Swedish research in treatment has been to look at, in some cases using your registries, at the social and cultural aspects of treatment, including the consequences of treatment and the interaction of treatment with individual characteristics, including culture, gender, age, etc. But also the relevance of policy, treatment policy, and client attributes. Certainly there has been an important early emphasis in the long-term follow-up of treatment. It is always important to us in the field how long, whatever interventions we are undertaking, how long those treatments or interventions have in affecting the lives and rehabilitation of clients. Treatment research in Sweden, again, has been a particularly important area in its breadth of coverage, looking at alternative sites for delivery of addictive response, including primary health care, specialized inpatient treatment, and including even up to coerced forensic treatment. Again, the research has included, in important ways, different age cohorts, including adults, adolescents, students, and my group, the elderly. There's been a special strength, I think, in substances, alcohol, amphetamines, and illicit drug. Not as much emphasis on smoking cessation as there has been in other countries, though I'm not certain, according to our tobacco expert, that that's by itself a particular concern, just a comment. Prevention and policy research, this is the question of how do you get in front of a problem and how do you affect it. Sweden has had and has in many ways shaped the history of the use of public policy and policy responses to reduce heavy drinking, illicit drugs, and tobacco use and harm. And as a result, it has been on the forefront in doing studies in this area. One of the particular contributions that Swedish researchers have made to this field has been using advanced statistical techniques. One of particular interest to me in the policy area is looking at using time series analysis to examine trends and the relationship of trends, patterns, and interventions on harm. We'll talk a bit more about smokeless tobacco, snus, but it was identified in our review as a unique opportunity because of the considerable use of snus and smokeless tobacco in Sweden, and whether it resides, what kind of opportunity it will provide in studying health risk and your low smoking prevalence. One of the unique things that's affected not only Sweden, but the other Nordic countries as a result of either membership or attachment to the European Union, which in some ways is rather unique in the world, and that is giving more and more responsibility and accountability to your municipal government for undertaking prevention. This has come about in many ways in response to the loss of your historical policy strategies, which included monopoly, not only monopoly retail sale of alcohol, but also the elimination of the production and import monopoly that Sweden enjoyed prior to membership in the EU. I come from a country where we don't have a tradition of national policy, or even for that matter, even state level policy, so that the burden of responsibility for prevention has been at the municipal or local level for many years. The problem we have, and you have, Sweden, is the limited amount of research on that area in terms of effectiveness, in terms of strategies that have worked, what are the conditions, what are the factors that affect the effectiveness of policy and prevention strategies at the local level. So I identify that as a weakness or a limitation of the published science that we looked at. Another opportunity that I feel perhaps is being missed is within the Europe community, Sweden has a unique national policy concerning illicit drugs, but there's been very little in the work we looked at, quantitative research concerning policy effects. Much more emphasis on understanding the dynamics, maybe cultural or political issues, but not looking at the outcomes and the overall effects. And I consider that, for me, and I think in our recommendations, a significantly missed opportunity.